Hello medicals, welcome to this channel. So let's start the topic arterial blood gas interpretation. ABG is a diagnostic test and very important in critically ill patients. So the normal values on ABG are pH whose normal range is 7.35 to 7.45. PaCO2 normal range is 35 to 45 mmHg. HCO3 normal range is 22 to 26 MEq per liter. PO2 normal range is 80 to 100 mmHg. Those values are very important for ABG interpretation. So those values should be remembered before interpretation. ABG interpretation can be done in three steps. First, identify if it is acidosis or alkalosis by its pH value. If pH less than 7.35, it shows acidosis. If pH greater than 7.45, it shows alkalosis. Second step, identify if it is respiratory or metabolic by its CO2 and bicarbonate level. CO2 represents respiratory. CO2 level less than 35 shows alkalosis and greater than 45 shows acidosis. Bicarbonate represents metabolic. Bicarbonate level less than 22 MEq per liter shows acidosis, but greater than 26 MEq per liter shows alkalosis. Step 3. Identify if it is uncompensated or compensated. If compensated, it's fully or partially. Let's see an example where pH is 6.8 and bicarbonate is 24 MEq per liter. PaCO2 is 67 mmHg. Then here pH is at acidic side. Bicarbonate is in normal range. PaCO2 is in acidic side. So now we can say that it is a case of respiratory acidosis. Let's see another example where pH is 7.8, bicarbonate is 24 MEq per liter, PaCO2 is 30 mmHg. Then here pH is at alkaline side. Bicarbonate is in normal range. PaCO2 is in alkaline side. So it is a case of respiratory alkalosis. Let's see some more examples. Here pH is 6.8, bicarbonate is 18 MEq per liter, PaCO2 is 42 mmHg. Then here pH is at acidic side. PaCO2 is in normal range. Bicarbonate is in acidic side. So here pH is acidic and bicarbonate shows metabolic condition. So it is a case of metabolic acidosis. Let's see another example where pH is 7.8, bicarbonate is 45 MEq per liter, PaCO2 is 38 mmHg. Then here pH is at alkaline side and PaCO2 is in normal range. Bicarbonate is in alkaline side. So pH is alkaline and bicarbonate shows metabolic condition. So it is a case of metabolic alkalosis. So we have done uncompensated with some examples. Now let's begin compensation and rule out it is fully compensated or partially compensated. Before proceeding further, we should remember some points clearly. 1. In respiratory acidosis, bicarbonate level increases to compensate acidosis that is greater than 26. In respiratory alkalosis, bicarbonate level decreases to compensate alkalosis that is less than 22. In metabolic acidosis, CO2 level decreases to compensate acidosis that is less than 35. In metabolic alkalosis, CO2 level increases to compensate alkalosis that is greater than 45. Those are the points we should be clear and remember clearly. So let's revise once again. In respiratory acidosis, bicarbonate level increases to compensate acidosis. In respiratory alkalosis, bicarbonate level decreases to compensate alkalosis. In metabolic acidosis, CO2 level decreases to compensate acidosis. In metabolic alkalosis, CO2 level increases to compensate alkalosis. Before going further, let's get clear on one more thing. As we know, pH normal range is 7.35 to 7.45. So let's take 7.35, 7.36, 7.37, 7.38, 7.39, 7.40, 7.41, 7.42, 7.43, 7.44, 7.45. Here from 7.35 to 7.40 shows normal acidic side, and from 7.40 to 7.45 shows normal alkaline side. So let's remember this range. As you know, patient diagnosis, that is respiratory condition or metabolic condition, matters a lot in ABG interpretation. In respiratory condition, CO2 level shows variations. In metabolic condition, bicarbonate level shows variations. So now let's rule out compensation, that is fully or partially, with some examples. So let's see an example where pH is 7.31, bicarbonate is 48 mg per liter, PaCO2 is 51 mmHg. Then here pH is at normal acidic side, CO2 is in acidic side, bicarbonate is at higher side trying to compensate but not fully compensated because pH is at acidic side. So it is a case of respiratory acidosis partially compensation. Let's see another example where pH is 7.52, bicarbonate is 41 MEq per liter, CO2 is 52 mmHg. Then here pH is at normal alkaline side, bicarbonate is in alkaline side, CO2 is at higher side trying to compensate but not fully compensated because pH is at alkaline side. So it is a case of metabolic alkalosis partially compensation. Let's see some more examples where pH is 7.36, bicarbonate is 31 MEq per liter, CO2 is 51 mmHg. Then here pH is at normal acidic side, CO2 is in acidic side, bicarbonate is at higher side to compensate and fully compensated to reach pH at normal acidic range. So it is a case of respiratory acidosis full compensation. Let's see another example where pH is 7.43, bicarbonate is 38 MEq per liter, and PaCO2 is 48 mmHg. Then here pH is at normal alkaline side, bicarbonate is in alkaline side, PaCO2 is at higher side to compensate and fully compensated to reach pH to normal alkaline range. So it is a case of metabolic alkalosis full compensation. Hope this video is useful to you and helps you in ABG interpretation. If you like the video, press the like button and subscribe to our YouTube channel and hit the bell icon. Thank you.